Across Europe, borders are reopening today as more and more countries ease measures imposed to control the spread of the coronavirus. Ahead of the midnight reopening, people gathered along the border between France and Germany to celebrate their restored freedom of movement. The frontier was one of many closed 3 months ago, but not all of Europe's internal borders are reopening today, and the continent still remains closed to visitors from outside the EU. DW correspondent Bernd Riekert is on the German-French border and joins us from there. Bernd, this is a moment people there have been waiting a long time for, isn't it?
The border was closed actually for 3 months due to corona measures, and people in the region here across the border are very happy that this is over now because their personal life got restricted very much. Family ties were cut, and also workers had difficulties. But you have to say that the border was not really closed. Border controls were invented. People could cross with difficulties, and also goods were going back and forth. But now this is also a good moment or a joyous moment for Europe, if you want, because now the Schengen travel area is back. Achievements of the European Union, and now it's up and running again with a few exceptions.
Well, besides Germany and France, other EU member states, of course, are also reopening their borders, but regulations do differ from country to country. Stay with us, Bernd, while we take a look at what some of these countries are doing right now.
European countries are beginning to lift their COVID-19 restrictions, meaning the border-free Schengen area is gradually opening up again. Here's a closer look at what the plans are from Monday, June 15th. These countries are granting full or nearly full access to EU and Schengen states: Germany, Belgium, Estonia, France, Iceland, Italy, Poland, Switzerland, Slovenia, and Sweden. Some countries, like Estonia, will require people to quarantine if they arrive from a country with a high infection rate. These states are only opening for citizens from particular countries: Austria, Czech Republic, Denmark, Lithuania, Latvia, Hungary, Norway, the Netherlands, Slovakia, and Finland. Tourism-dependent Greece is relaxing its rules the most, welcoming international travelers from outside Europe. However, people from badly affected countries will face testing and quarantine.
Bernd, Europeans are happy to be getting their freedom of movement back, of course, but are they not concerned that open borders could bring another surge in coronavirus infections?
Well, the level of concern is quite low now. There's a fresh survey saying that 62% of the people in Europe intend to travel within the Schengen area in the next 2 or 3 months. So tourism will be back. Infection rates, for example, here in Germany and France on the other side of the border are quite low. And even if they go up, now people here want to follow a regional approach, not closing of the borders, but stopping infections in the hotspots will be the new recipe. They say here you can't take away Schengen from us again. So come up with some new concept. And there was also anger at Paris and Berlin that they closed the border, not regarding the circumstances along the border.
Bernd, thank you so much. DW's Bernd Riekert there at the Franco-German border. China's capital, Beijing, is bracing for a resurgence of the coronavirus after more than 100 new cases were reported in recent days. Mass testing is being carried out after the city had been free of local transmission for more than a month. The latest cases are being linked to the city's largest wholesale food market. Mexico reported more than 4,000 new coronavirus infections on Sunday, along with 269 fatalities. That brings its total confirmed cases to more than 146,000 and 17,000 deaths. But even the government says the real number of infections is probably significantly higher. We followed one first responder and the challenges he faces in Mexico.
His oxygen level is low. He can hardly breathe. He had a 38-degree fever. He hasn't been able to stand for 3 days. It's probably COVID. We're taking him to hospital. It's another tough day for the Red Cross team in Mexico. For Diego Alcoa, it's now one of too many. And getting the patient to the hospital won't happen. I'm sure if they take him away, he may never come back. Diego leaves the man, whose chances don't look good, with a heavy heart. Family ties are strong in Mexico. They prefer for someone to die with their loved ones, even if they could be saved in a hospital. The capital has been at a peak pandemic probably for weeks, but nobody knows for sure. There is little coronavirus testing. It's distressing not knowing how many are really infected, so we won't know when this is going to end. I'm going in. The next mission with lots of family members cramped in a small space. Are you afraid of catching it? He has pneumonia. That's how it often starts. Since hospitals are almost always overcrowded, Diego can only take critical patients. He is stable. But thousands of Mexicans are losing the battle. The crematoria are working at full capacity. The relatives only have 5 minutes to say their goodbyes. Everything has to be done quickly. Charlie hasn't taken a break for weeks. In Mexico, mortality rates are above average. I've never had to deal with so many dead people before. It's risky. I'm scared because I have family. A relative must always confirm the deceased to avoid mistaken identity. What enrages Charlie is that many Mexicans deny the coronavirus exists. Why don't people switch on their brains? If this keeps going on like this, I don't know when it will end. Mexico wants to get back to normal, but Diego is worried about his fellow citizens and his team.
Well, here's a roundup now of some other developments in the coronavirus pandemic. Almost 8 million people are now reported to have been infected, and more than 433,000 have died. That's according to the tally by the Johns Hopkins University in the U.S. More than half of all U.S. states are reporting an increase in cases, with many seeing record spikes and hospitalizations. It comes as most states push ahead with reopening. Thailand has lifted a nationwide curfew after more than 2 months and allowed restaurants to resume selling alcohol. It's not reported any domestic transmissions of the virus for 21 days. And Germany plans to make 500 million euros available to firms to prevent a collapse of in-company training and apprenticeships. The German government has also agreed to 2 stimulus packages to mitigate the economic impact of the COVID-19 crisis.